Lastly, of the upper respiratory tract infection is tonsillitis, which affects the tonsils. That's inflammation of the tonsils. Can be acute or chronic, caused by viral or bacterial infection, and mostly tonsillitis affects children. Symptomatically, again, is more or less the same symptoms that we have discussed about the sore throat, difficulties opening the mouth, halitosis, that is bad breath, red swollen tonsils, voice impairment, noisy respiration, difficulties in breathing. Again, to diagnose that, just physical examination, you should be able to diagnose tonsillitis. But again, you can do a throat culture just to determine the causative agent, the exact causative agent. You manage that by giving supportive measures that are going to help to relieve the pain, like warm salt water gargles. It relieves the pain. Painkillers, ibuprofen is the most recommended painkiller. Fluid intake, which is going to thin the secretions. Rest for the patient. If this bacterial infection, manage with antibacterials, penicillin. But usually tonsillitis should be able to resolve within 7 to 10 days. Again, to assess your patient, this is general assessment for patients with upper respiratory tract infections. Health history taking, if you do proper history taking and physical examination, you should be able to diagnose that. And usually, the most common symptoms that cuts across the sore throat, the headache, the pain, difficulties in swallowing, cough, hoarseness of the voice, fatigue, general discomfort, these ones cut across. Check for history of allergies, inspect the nasal mucosa, inspect the throat, palpate the lymph nodes for enlargement or tenderness. This cuts across. Your nursing diagnosis, there are so many: ineffective airway clearance, acute pain, difficulties in breathing, impaired verbal communication. So you can look at this nursing diagnosis and you can see, you can at your own time read through your nursing interventions for each of these nursing diagnoses. Your nursing management, which I've just mentioned about all along, positioning and managing the secretions. So the Zenphylus position, which will help with the drainage of the secretions. Fluid intake, which is going to thin the secretions, which will allow them to be expectorated. Promote comfort, give the painkillers, hot packs, warm salt gargles, which are going to relieve the pain. Encourage patients to take prescribed antibiotics accurately as prescribed. Teach the patients on the sense that will require them to seek further health care treatment.